Hello, my name is Martina. I'm a public health nurse. I'll be giving you advice today on introducing solid food to your infant. It is vital that the food that you introduce to your infant is healthy food. It is important not to introduce food before 17 weeks and no later than 26 weeks. The introduction of gluten can begin after 26 weeks. If you introduce gluten too early, before 17 weeks, or too late, after 30 weeks, your child has an increased risk of developing celiac disease or type 1 diabetes in later life. Around 4 to 6 months, your child may start showing signs that they are ready to commence on solid food. These signs are that they are not fully satisfied with their milk feeds, they begin to demand more milk feeds more frequently, and this should last longer than 1 week. They show more interest in food, they may begin reaching out for food. They watch with interest when others are eating food. They chew or dribble more often, and they're able to sit up with some support. Exclusive breastfeeding is advised from the World Health Organization up until 26 weeks of age. Formula-fed babies may require weaning earlier, but it is vital that you follow the guidelines of between 17 to 26 weeks. Begin by sitting your infant in a supported seat. Do this at a time of the day when you are quiet with little distractions. Introduce your child to solid food by beginning with purees such as pureed vegetables or baby rice. Start with one new flavour at a time and opt for savoury vegetables rather than sweet fruits. It is better to introduce savoury fruit first, as babies have a preference for sweet foods. Breast milk and formula milk are very sweet tastes. In this initial period, you are teaching your child to take food from the spoon. Allow them to suck the food off the spoon. It may seem like they're spitting it out, but they're only just getting used to the new tastes and textures. Give your child 2 to 3 spoonfuls initially. Continue with breastfeeding on demand and formula feeding as normal at this stage. Repeat this for 1 to 2 weeks until you are satisfied that your child is managing well. It is important that no salts, sugars or gravies are added to your child's food. They do not require them, and nor do they look for them at this stage. It is important their food is as natural as possible. Homemade foods are relatively cheap to prepare when compared with ready-made shop-bought foods. Try not to rely on shop-bought foods every day. Introduce the cup for your child's mealtime straight away. It is important they learn that with meals comes the cup, and it is the beginning of your weaning from the breast or bottle. Once your child is managing well on puree, it is important to move them on to more mashed, lumpier and textured foods. Coughing is normal when lumpier foods are introduced, and this will pass as your child becomes more used to the lumpier consistency. Remember, always supervise your child when eating. Don't be afraid to let your child finish feeding themselves with their own spoon. During this stage, you can continue breastfeeding on demand or give 3 to 4 formula feeds a day with a maximum volume of 800 ml and give cool boiled water with meals in the cup. From 9 months of age, your child is ready for chopped foods, lumpy foods and hard finger foods, and a wide variety of foods and textures. It is vital that your child is eating more textured and lumpier foods at this stage. Your child should be taking 4 to 6 tablespoons of family food at this age, with 2 to 3 healthy snacks a day. The drinks for your infant is cool boiled water, breast milk or formula milk. Avoid juices or any fizzy drinks. Cow's milk is not recommended up till after 1 year of age. Breastfeeding at this stage should be on demand. The maximum amount of formula milk is 600 ml. If your child refuses food, do not worry. Sometimes it takes up to 10 to 15 tries on different occasions for them to accept certain tastes. Allow your child to eat to their own satisfaction. Do not try to force feed them if they don't finish their portion. If you are concerned that your child may be eating portion sizes that are too big for their age, please refer to the Feeding Your Baby Introducing Family Meals booklet given out by your public health nurse. Foods which you should not give your infant are honey or sugar, unpasteurised cheese, undercooked eggs, bran, tea or coffee, liver, processed or cured meats such as ham or bacon, high fat or high sugar foods such as crisps or chocolate, and whole or chopped nuts.